This is Nurse Corey from Synergy Home Care of Arlington with an update on the coronavirus. Thank you again to In the Know Caregiver Training who provided this material. As of March 28, 2020, more than 660,000 people have become infected. More than 30,000 people have died, and the virus has infected more than 117,000 Americans in all 50 states. Over 2,000 Americans have died. Nursing homes and hospitals across the U.S. are shutting their doors to visitors, and hospitals are preparing to become overrun by new cases of coronavirus. We are all at risk for infection. No one is immune to the coronavirus, and even though elderly people are at higher risk of death, the CDC has released a new estimate that 38% of cases that require hospitalization are people aged 20 to 44 years old. We're all being affected by this virus, and as the number of COVID-19 cases grow, it may become more personal as we ourselves show symptoms or are caring for someone who is showing symptoms but not yet confirmed by testing. How will you care for these people or yourselves? Symptomatic treatment. Encourage plenty of fluids. Urge the person to get plenty of rest. Some over-the-counter medicines may help with symptoms. Be sure to check with a medical provider before recommending medication. For most people, symptoms last a few days and get better after a week. Monitor for emergency warning signs. These are trouble breathing, persistent pain or pressure in the chest, new confusion or unresponsiveness, and bluish lips or face. For these medical emergencies, call 911 and notify the dispatch personnel that the person they're coming for may have or is suspected to have COVID-19. While Synergy Home Care caregivers will not be caring for COVID-positive clients at this time, it's important to keep in mind the following isolation precautions that are necessary for the care of COVID-19 positive patients. Try to keep the person isolated in one room and away from other people as much as possible. If face masks are available, have the symptomatic person wear a face mask when other people, including you, are in the room. Follow both contact and droplet precautions. Contact precautions are wearing gloves and a gown for all contact with the person and their environment. Droplet precautions are wearing a mask that should be worn for contact within 3 feet of a symptomatic person. If available, use of an N95 mask, and if no N95 mask is available, such as when you're caring for someone at your home, use a surgical mask if you have one. If a surgical mask is not available, as a last resort, you can use a bandana, scarf, or a homemade mask. What does social distancing really mean? Social distancing, self-quarantine, isolation, and shelter in place, all terms commonly used these days. You'll hear them from politicians, newscasters, and maybe even be using them. But what does it mean? How are they different? Here's a breakdown of the terms. Social distancing is when we purposely increase the space between people. Staying at least 6 feet away from other people can decrease your chances of catching COVID-19 because that is how far away the droplets can travel when someone near you coughs or sneezes. Social distancing will not stop the spread of the coronavirus, but it can slow it down and fewer people will get sick. How do you maintain a social distance if you're trying to take care of someone? That's tricky. If you're providing personal care, you're interacting with someone at a distance closer than 6 feet. So, if you suspect the person could have COVID-19, have them wear a mask. Always wash your hands and put on gloves before coming in contact with the person. Limit talking during the close contact, and if you have to cough or sneeze during your care of them, turn your head or walk away. Self-quarantine is when you voluntarily stay in your own home to stay away from others for a period of time during the outbreak. If you feel the need to self-quarantine, let our office know. Isolation is required for anyone confirmed to have COVID-19. It is the only way to keep people who are infected with the virus away from those who aren't and stop the spread. While Synergy Home Care providers will not be caring for clients in isolation, be sure to understand that if you did need to come into contact with someone confirmed with COVID-19, you would need the proper protective equipment in order to do so. Shelter in place. Several cities across the U.S. have issued shelter in place or stay at home orders, meaning residents of those areas are required to stay at home unless they have essential reasons for coming out, including getting food, medicine, or going to work. In cities where this order is in place, all travel is prohibited. Residents cannot walk, bike, drive, or use public transportation unless their travel is considered essential. Healthcare workers and Synergy Home Care workers are considered essential personnel. Last time we talked a little about not touching your face, but research shows that most of us touch our faces at least 16 times a day. Under normal circumstances, it wouldn't be that big of a deal, but we are not living under normal circumstances right now. Try to think of your face as an on-ramp to your body. The mucous membranes on your face, your eyes, nose, and mouth are superhighways to your respiratory system. So, if the virus is on your hand when you touch your eyes, nose, or mouth, even once, it could hitch a ride to your lungs and make you sick. It's that simple. Even if it's a hard habit to break, try not to touch your face. Here's a few tips you can use. Wash your hands with soap and water often throughout the day. Using soaps or lotions with a pleasant scent may remind you not to touch your face because as you bring your hand close to your face, the scent can bring you back into awareness. If you absolutely can't fight the urge to scratch your nose, at least grab a clean tissue to use as a barrier. I hope you found this update valuable. Please continue to reach out with questions, concerns, or to report symptoms of COVID-19. We care about our caregivers, we care about our clients, and we care about stopping the spread of this disease. Be well.